We often use prefabricated macros for our charting because patients often have similar patterns of medical complaints. But there are other common problems in the ER that we see over and over. You can use mental macros in the same way to deal with these kinds of problems. Some of my favorites deal with meandering history, explaining with fire, angry families, and a few nuclear weapons. Sometimes patients give us much more information than we want.
How long have you been having this neck pain?
Oh, quite a while now.
Can you be more specific?
I'm pretty sure it was right after Vanessa and Brad's wedding.
Okay, but I don't know these people. When was the wedding?
It was just before our trip to Italy with my sister and her kids. One of them is allergic to gluten.
We've all been here before, haven't we?
When was your trip to Italy?
Oh, I've been several times. The first time was in high school, with my history club.
Sometimes, no matter how many questions you ask, the patient just keeps going further and further off track.
He never should have married that horrible bitch Carlene.
If a patient keeps giving vague details, instead of asking more questions, try a bold, declarative statement.
How long have you been having this neck pain?
Oh, quite a while now.
Oh, so at least 12 years then.
What? I never said that.
Some patients would just rather contradict you than give a direct answer.
It's been maybe 2 months. Are you stupid or something?
Prescription instructions can be pretty confusing to a layperson.
Doctor, I feel a lot better. Are you going to send me home now?
I'm sending you home with a prescription. Let me explain how it works. Blah, 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 asthma, blah, blah, prednisone, blah. If you think a patient is having trouble understanding, use fire as an example. Blah, 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 comply. Everyone understands that.
So should I just take this prednisone until my wheezing stops?
No. Imagine your asthma is like a large fire, and your prednisone is like a small cup of water. If you throw just 1 or 2 cups of water on the fire and stop, the coals are still there. And that fire will return because you stopped too soon. But if you keep throwing on cup after cup, the fire will go out for good.
I understand now. Take it all, even if I feel better in a day or 2.
Now you get it.
It's still okay for me to smoke crack cocaine and cigarettes every day, right?
Of course, you can't win them all. Some families never get over old conflicts.
I want Mom to go back to hospice.
I want her in the intensive care unit. You just want Mom dead so you can get money for your drug problem.
Often a discussion about patient care quickly gets personal and ugly. It gets especially bad with siblings.
You are a selfish, cynical scumbag who worships death. I hate you. You were always her favorite.
Maybe that's because I didn't seduce our stepbrother. Twice.
Usually, everyone's trying to pose as the best person who loves the patient the most. Use this.
At least your husband finally got laid, you frigid, morose cow.
Yeah, he really loved getting your prison syphilis.
Enter exasperated dad or mom mode and make them want to please you to show their virtue. I can either help your mother or deal with all this drama between you. I cannot do both. Now let's be adults and put her needs first. Oh, I'm sorry, Daddy.
I am a very important cardiologist. I'm sending a patient in. Give them a blood transfusion.
Sometimes you have to fight for self-respect, even if it could cost you your job.
I'm the head of cardiology, you stupid quack. I do not need your attitude. Just keep doing rectal exams.
Use nuclear weapons cautiously. There is a price. Let me make something really clear. I will work with you, but I do not work for you. I will happily help your patient in my department, but you will have to treat me like a colleague. Call me back when you're feeling better. If you have to cut loose on someone, keep it highbrow. Do it as if you're being recorded, because believe me, you probably are. If you're able to avoid using curse words, you might keep your job, if that matters. Everyone in this hospital comes here to work. We do not come here to surrender our dignity to you.
You've made it clear that you don't respect me or my staff. I can live with that. But I absolutely insist that you try faking it better. You don't have to like us to treat us like human beings, you know.